You have learned what allergies, what hypersensitivities, what idiosyncrasies in your college times. So I am not going for the details of the allergy or the hypersensitivity. So in our clinical practice, we are getting usually allergy rhinitis, allergic asthma, atopic eczema, urticaria, insect venom, insect bite actually, and drug allergies are there, and food allergies, and multiple allergies. These are the allergies what we are getting in our clinics. These are the common allergic presentation. Not only the allergic rhinitis, there are ever so many allergic diseases. There is no absolute cure or permanent cure for allergies in modern medicine medical system. What we are offering and what we are delivering is absolute relief from allergies. That means that it won't recur even after exposure to the allergies. So let us see an evidence-based treatment protocol of allergic disorders. To develop a protocol, there should be a minimum of 7 steps. First one is to investigate, to diagnose the allergies, to diagnose the disease. In this case, it is allergies. It is better to do the investigation prior to your treatment. If at all they are under any other treatment, you have to repeat the test, allergy test. We will discuss what are the allergy tests. And if it is countersigned by the modern medicine, that is well and good. If they are under modern medicine treatment, you have to keep the records of the modern medicine treatment. Otherwise, it will become an self-limiting disease later on. So it should be countersigned. And second one is drugs as per the cause of the disease. What we mean by drugs, this is what modern medicine is doing. Drug will alleviate the symptoms for the time being. So there won't be any symptoms like sneezing, itching, urticaria, or diarrhea, or no symptoms will be there. To relieve the symptoms, they are giving medicine. We are also having medicines to relieve the symptom immediately or within no time. That is what we call drugs. Drugs will only relieve the symptoms, not the disease. And third one is the medicine for the disease. For allergic rhinitis, there are prepared medicines. That means the proved medicine which covers the symptoms of the allergic rhinitis, which covers the symptoms of the urticaria, which covers the symptoms of the lactose intolerance, which covers the symptoms of the insect bite or insect venom. Like that, there are medicines. And these medicines will space the disease. There won't be any disease while they are taking the medicine. This is what is happening in modern medicine. While they are taking medicine, there won't be any symptom. But it will recur whenever the medicine has been withdrawn. Like the drugs, whenever the drug is there, the dreadful symptoms or the severity of the symptoms will be relieved. And as far as the patient is continuing the medicines, there won't be any disease. Like Astacus fluviatilis in urticaria, as far as the patient is taking the Astacus fluviatilis, there won't be any urticaria. But as soon as the patient stops what we call Astacus fluviatilis or epis, it will recur again. So there should be a remedy that has to finish the case. There won't be any recurrence after giving the remedy. Remedy may be a constitutional remedy. But in allergy rhinitis, we can reach into a conclusion that in the certain diseases, certain remedies are enough. In certain constitution only the urticaria is coming. In certain constitution only this lactose intolerance is coming. In certain constitution only the allergy rhinitis or the dust allergy is coming. That is why we are reaching into a conclusion that a remedy that can prevent the recurrence. This is important. Why? Because we have to deliver what we are offering. This is what quality is. We are delivering, we are offering permanent cure, and that we have to deliver. And the potency, dosage, and repetition. As far as we are discussing about the protocol, it should be like that. It should be in potencies, in repetition, and in dosage, and a logical philosophical guideline. After curing a disease, we have to evaluate how and why the cure is established. And if it is not established, then again it has to be evaluated on the in terms of philosophy, and there should be an endpoint. We have to fix a date or a day or months where we are going to finish the treatment. There won't be any treatment thereafter. So these are the 7 steps of all protocols. That is what I do believe. So let us see one by one what are the steps of the allergic disorders. What are the steps we have to follow for the allergic diseases. So investigation for diagnosis. So allergic diseases, it should be evaluated or investigated properly. Even though patient is under the treatment of modern medicine, then again we have to send the patient for new investigations. Routine examination, all of you know, and we are focusing on the eosinophil. And patient themselves may say that I am suffering from eosinophilia. Eosinophilia is not a disease; it is a sign only. Whenever there is eosinophil count is increased, that is a sign only. And an immediate follow-up of the eosinophil count or the eosinophil count in routine examination, that is the TCD, CSR, SP percentage. That is absolute eosinophil count. If the absolute eosinophil count is increased, then we have to send the patient for total IgG. The available test in our area is total IgG. In certain area, total IgM is also available. And specific IgM and IgG for the diseases and all, it is also available in laboratories. And allergens and antibodies. There are 450 tests for various type of allergens like pasta, rice, milk, like that. If patients are ready to do for the go for the test, then you have to send the patient for the investigation, like a specific investigation. What are the allergens that we can identify, and there are medicine for each item or each food items. Each for the dust there is another remedy, and for milk there is another remedy. Like that, you can specifically diagnose. And next one is spirometry, especially in case of bronchial asthma. Not especially, only in case of bronchial asthma or COPD or lower respiratory diseases, spirometry is a diagnostic criteria. And stool for reduced sugar. Usually, people are skipping this investigation. It is only a matter of 10 rupees in India. It's only a matter of 10 rupees to diagnose the lactose intolerance. There are only two inferences in reduced sugar in stool. That is one is lactose intolerance and the other is viral diarrhea. If a diarrhea is lasting for more than 3 weeks, that is an acute condition, and then this stool for reduced sugar will be positive. And if it is without the viral diarrhea, if it is without the acute symptoms, and if patient is saying that she or he is having lactose intolerance, it is better to send the patient for a stool reduced sugar. These are the common investigations to diagnose the condition, allergies. So, the first step is our routine examination, eosinophil in the routine examination, absolute eosinophil count, followed a follow-up investigation, and total IgM followed by total IgG. Total IgG indicates the patient has been suffering from allergies for years. Total IgM positive, a current allergy is persisting, and specific IgG and IgM for the diseases or something like that, and the antibody test for antigen test for allergens, spirometry, and stool for reduced sugar. These are the investigation for confirmation of the allergic disorders. So this is the case. We'll discuss the case later on. So this is the way how we have to document the allergic disorders, not simply the eosinophil count. You can see the total IgM is there, so total IgG is there, absolute eosinophil count is there. So after treatment, it comes down. If at all that comes down for a time being, it's a case treated 14 years back. Actually, it is in 2006. And if the IgM or IgG comes down after the treatment, if it is persists for 1 year, that won't count, because that may increase even after 1 year. So if it is not increasing after stopping your treatment, if it is not increasing even after 1 year, that is a cured case. This is a cured case. So there are never so many such cases. This is a cured case 14 years back, actually. So this is the way how we have to send the patient for investigations. So let us see the drugs as per the course of the disease. Patient may be in need of immediate relief for their suffering. So we can see what are the drugs we can give for the acute symptoms. So allergic rhinitis, for the immediate relief of the sneezing. Allergic rhinitis, all of you know, the main problem is itching of the nose, sneezing, or blockage of the nose, like that. So pothos tincture, ammonium carb 30, and arsenicum album 3s. These are the medicines that you can give if there is minimum, that is well and good. Otherwise, for the this dust allergy, pothos fotida, ammonium carb for what we call the morning sneezing. The sneezing will be only in the morning. It is called there is difference of body temperature. in the morning after waking. That is the reason for the morning sneezing. That is ammonium carb and arsenic album. Usually, in a lot of protocol, the arsenic album 3x is coming. Why? Because all the drugs we are giving in the low potencies, because there is no deep acting. There is no need of deep action. It will only relieve the symptoms for the time being. And allergic asthma, iodoform 3s, that is a bronchodilator. Instead of giving or instead of taking inhalers, there are ever so many inhaler asthmas are there. So to withdraw the inhalers, iodoform, it is better to give 1x, but it won't exist more than 2 months. There will be a mild blue color and there will be an aromatic smell. If the smell and color lost, the iodoform is not working. So that you can give sublingually. And iodine is also beneficial in respiratory embarrassment with temperature. Iodine 3s and naphthalene 3s, especially for the smokers bronchitis or smokers cough. And passiflora, we mercilessly refuse the passiflora to the patients, those who are having the asthma. Usually it gets aggravated in the night and patients are in need of peaceful sleep. It is a bronchodilator as well as it can produce sleep also. And atopic eczema, if it is weeping eczema with a lot of fluid, a lot of pus, gunpowder 3s, repeated doses, and myrica tincture, it is called as a homeopathic antibiotic. So just like an antibiotic, you can give myristica, not myrica, myristica tincture and oleander tincture. It will increase the supply to the blood supply to the skin. So oleander tincture, all are internal. And urticaria, for immediate relief, acetaminophen or antipyrin 3x, especially with the fever, and Epis 30 and Bell 200. What I am doing is Epis 30 and Bell 200 will be alternated 2 hourly for immediate relief for the itching and this arterial eruptions. And drug allergy, it is better to it is because of the drugs. So they have to antidote. This is my rule. It is because of their medicine, so they have to find out an antidote to their medicines. And if it is not working, autopathic medicines, it was available from Dr. Patel's pharmacy in Kottayam. They are preparing medicines from the allopathic medicines. If it is from an analgesic, you can give the potential form of the analgesic itself. Like that. For the drug allergy, I think it is their cup of tea. They have to take, because they are responsible. Those who give the medicine, they have to give the medicine. So you just tell the patient to go and see your doctor and antidote their medicines. And insect venom, if there is severe pain and swelling, instead of Epis, it is Epium virum. Epium virum is it is actually the poison of the Epis, the fly. So Epium virum 30. And food allergies, especially usually the shellfish allergy is common. For all from the crab, from the prawns, like that. Artica uranus tincture and bromium 30. The potency is not mentioned there. Bromium 30. Artica uranus tincture and bromium 30. And for wheat, wonderful action for chromium mure and chromium sulf. So it will relieve the symptoms immediately. I remember a patient, though she will fell unconscious after taking the wheat. So she will be unconscious for a long period, and she has to admit in the hospital. What I gave in the beginning was chromium mure, and she took wheat along with the chromium mure, and it is relieved, and followed with the other medicines and remedies that you will see later. And egg allergy, chininum as 30 and chininum sulf 30. If it is a decayed egg, it is better to select chininum sulf. And in chininum sulf, there will be foul smelling diarrhea, and there will be foul smelling irritation, like that. Chininum as, there will be loss of appetite and there will be weakness. And milk allergy, valerian and ethusa 30. Valerian tincture and ethusa 30. These are the drugs. Likewise, we can list a number of drugs that can be substituted the modern medicine, that can be substituted the allergen, that can be substituted the antihistamines. There is absolutely no need of giving antihistamines during the acute exacerbation. Why I am telling like that? Antihistamines and steroids will spoil the action of our medicine. You cannot prescribe simultaneously with the this antihistamines and steroids. We cannot prescribe our medicines. So these are the drugs. There are ever so many. I am discussing because of lack of time. I am discussing only few. And let us see what are the medicines for the disease. In the same condition, As a modern medicine people, they are giving medicine for a long period and there won't be any disease while taking the medicine like that. And allergic rhinitis, we are discussing only 10 allergies today. Why? Because we have to finish everything within 30 minutes. So allergic rhinitis, bromium 30, heparsol 30 and kalinetricum 30. For allergic rhinitis, if it is, especially if it is complicated with the nasal polyp and kalinetricum is good, and heparsol for the cold allergy, and bromium is for dust allergy. We prescribed pothos fetida for dust allergy in the beginning to reduce the acute symptomatology, to keep the patient symptom free for a long period. Though even the patient is exposed to dust, then prescribe bromine like that. For cold, heparsol. As far as the patient is taking heparsol, there won't be any throat pain, any sneezing or any asthma, even though patient is exposed to cold. And allergic asthma, antimonium arsenic. This is one of the best remedy I regularly using. I think we are giving order than anything for antimonium arsenicum. Just like the salmetabol, the antimonium arsenicum will work. It will relieve the pulmonary edema too. And arsenic album, all of us are prescribed during our academic times. We will make the case arsenic album while asking a leading question, sitting and bending forward amelioration. Is it is there after amelioration, after drinking warm water, then we will make it arsenic album and prescribe. And if it is a case of real arsenic album, my advice is don't prescribe arsenic album in centesimal potencies. There is every chance of aggravation. Even though the patient is not having asthma, if you are prescribing arsenic album, the asthma will precipitate. So it is better to prescribe in 0/3 or 0/6 or 0/1. I am prescribing 0/3 actually. And carbo vegetable is one of. Carbo vegetable is one for acute exacerbation, like the respiratory embarrassment or status asthmaticus. And those cases treated with the steroids to antidote the side effects of the steroids, you have to start the case with this carbohydrate. A better potency is 10 After giving a dose of 10 carbohydrate, you can give other medicines. And for atopic eczema, earlier we prescribed the drug in drug level. We prescribed gunpowder 3S, myristica tincture, like that, and oleander tincture like that. Okay, here to relieve the symptoms of the atopic dermatitis for a long time, crotantic 30 and sulfur 10. 10 is the active potency where there won't be any aggravation, and silicea 1. Why silicea is working in asthma and atopic eczema even without symptom was a $1 million question in my mind for years. I think it is because of the after effect of vaccination. Silicea is having an action on the after effect of vaccination. That may be the reason. Silicea 10, silicea 1, sulfur 10, and crotantic 30. Crotantic 30 in alternative condition with the asthma along with the skin eruptions. So when we are treating for the skin erosion, the asthma will increase. And whenever we are treating for asthma, the skin erosion will increase. To manage simultaneously, don't prescribe any other medicine, give this crotantic only. It will take care of the asthma as well as the skin symptoms. Don't repeat much. Weekly 1 dose like that. That is enough. And for urticaria, Astragalus fluviatilis. The most prescribed remedy is Astragalus fluviatilis. Almost all the symptoms are covered by Astragalus fluviatilis and Copaiba 30. These are the medicine. Whenever as we are prescribing these medicines continuously, there won't be any urticaria. But whenever you withdraw the medicine, there will be. So we will see what are the remedies that we have to give in laterally. Why we are not prescribing the remedy right now? That is also a question. From my experience, what I experienced is that if we prescribe the remedy in the beginning, we are hitting in the central core. So there will be aggravation of the allergic disorders. Whenever there is an aggravation of the allergic disorders, it is uncontrollable. The patient will go back to modern medicine. They won't come back. So that is why we are not prescribing the remedy in the beginning. We are prescribing the drug in the beginning, then move to the medicine that covers the whole symptomatology of the allergy, then only switch out to the remedy. Then there will be a peaceful landing. So in urticaria, Astragalus fluviatilis and Copaiba 30. These two medicines will cover almost all the symptoms of the urticaria, and there won't be any urticaria while they are taking the medicine. And drug allergy. Earlier I told you that It is their duty. They have to take care of the acute exacerbation or the side effect of their medicine. But if it persists even after giving their medicine, then drug allergy, only two medicines I got very good result. One is Res Venerata, especially after analgesic and antibiotics if there is erosion. And Pulsatilla Vandam. It is not a matter of, it's not the duty of Naxomica or sulfur to take care of the drug diseases. It is very well taken care by Pulsatilla. Pulsatilla is good. Pulsatilla will mildly handle it, and this Naxomica will violently handle it because it is an aggressive remedy. So Pulsatilla is good, and Res Venerata is another remedy if there is drug allergy persists or the after effect of the drug allergy even for months. And insect venom, epismal venom, Ledum 200 and Caladium 30. Caladium 30, you know, the mosquito rush is a common problem. Those are coming from abroad and all. And as far as the patient is taking Caladium, there won't be any mosquito rush. Mosquito will continuously bite. We can't prevent the mosquito. As the human beings are there, mosquitoes will be there. There are every government spend crores and millions of rupees to kill the mosquito, and mosquito is every day it is multiplying only. So Caladium will take care of the mosquito bite. All other bites covered by Ledambal if they are constantly exposed into the these mosquitoes or the insects. Once in a week, Ledambal and Caladium, especially for mosquito. All other insect, Ledambal. They have to take the Ledambal and expose to the this insect. So this is quite interesting. We are allowing the patient to expose to the mosquitoes, expose to the insect, expose to the allergens, and taking our medicine. So they will be more confident in our treatment, and we can win the heart of the patients. And food shellfish allergy. Earlier we saw Bromium, Artica oranus like that, and here Colosin 30. We are mercilessly refusing this remedy because it is a remedy actually. It's a medicine that covers the whole symptomatology of the of shellfish allergy. Colosin and Carbovage Vannam. Instead of like putting Carbovage Vannam is an intermediate remedy for shellfish. And wheat allergy. It's quite wonderful. The gluten allergy like that, and you can all it is called gluten allergy or glutamine allergy like that. So Calcirecar 200, then you can increase the potency later on. Calcirecar itself is enough. So it is damn sure. I am that much confident. You beg for a chance to treat a wheat allergy case and give only Calcirecar. It will definitely take care of the patient. Nothing will happen even after taking the wheat. After taking the Calcirecar, they can very well take the wheat. Let them allow them to take wheat. I am getting in a lot of North Indian patients, those who are working here in Kerala. They can take only wheat because they are very much fond of wheat. So Calcirecar saved hundreds of people. And egg allergy to space the disease. Whenever they are taking the Pulsatilla, there won't be any allergy after egg. That is Pulsatilla Vannam. And milk allergy from Valeriana Ethusa. Now we are moving to the medicinal part. As far as the myocarb is taking, there won't be any milk allergy. So this is not the end. So we are giving the medicine, and along with the medicine, they are taking the allergens. So we are going to finish the cases. So it's remedy to prevent the complications and recurrence. So second thing is important. Complications, of course, if there is any complication, they will definitely go for the treatment. But recurrence, what we are offering always, we are offering permanent cure. And patient will ask you one day, why it is not relieving? So we are also asking ourselves, why it is not relieving? The reason is that we never prescribe the remedy. So far, we prescribe the drugs and medicine. Whenever you are going back to your clinic, you have to turn back your case records and write down on the side of your case record which type of prescription you did. If it is a drug, then move to a medicine. If it is a medicine, then move to the remedy. So at the right time, we have to move to the remedy. Whenever the symptoms is alleviated, whenever we realize that we win the heart of the people. Already we want the heart of the people, so we are moving to the remedy. Remedy will be single always. There is no need of repetition like the medicine and drug. So allergy rhinitis, lysine 200 and tuberculum. Usually this is the end point. Whenever the symptoms are relieved, if it is of a dust problem, then move on to lysine. And if it is other problems, give a dose of tuberculin. Usually the symptoms of the lysine or the tuberculin will be there if you are probing to the case. Or you can find out another constitutional remedy if you are able to do. If you are not able to find out the constitutional remedy, just try lysine 200. That maybe give a few repetitions. Maybe there are tuberculin only one dose is enough, so there won't be any recurrence. What I am doing, I will tell the patient to report after 6 months. If there is any recurrence, I will repeat once again, and every year they have to report. And in certain cases, I will repeat. Otherwise, I won't repeat. You can give a dose of SL, and it is better not even giving a dose of SL, because patient has to convince that it is cured with our medicine. If at all we are giving SL, patient will think that I am still under treatment because he is taking a dose of medicine after 1 year. So it is better to keep off your hands. And allergic asthma, natron sulfonam, we are neglecting this remedy in case of bronchial asthma with the family history. There should be only one question: is there any family history? If there is a family history, the end point will be always natron sulfon. Though you are prescribing constitutional remedy, it is my humble request to prescribe a dose of natron sulfon to prevent the recurrence of the bronchial asthma. And you may read Kent Materia Medica. 6 times Dr. Ken mentioned about natron sulfon in bronchial asthma with the family history. So I don't know how many of you are prescribing. If you are prescribing, that is well and good. It will work. There won't be any recurrence. So we are offering complete recovery or complete cure. So permanent cure. So if you want to deliver what we offer, give a dose of natron sulfon in case of bronchial asthma with the family history, and medornum tenum, that is also with the family history of bronchial asthma with the cardiac complications also, congestive cardiac failure like that, or COPD like that, or cor pulmonale like that. There may be some cardiac complication in the family, and Soranum 200. These are the 3 remedies that can end the case. There won't be any recurrence, especially in chilly patients, those who are having the symptoms from exposure to cold, that is sorenum. Natron sulfon, I told you. Medorna, I told you. So in bronchial asthma, these are the endpoint. After prescribing a dose of natron sulfon for medornum tenum or sorenum, we are confident enough that it won't recur, and the patient will be more confident than you. So here only we will deliver what we offer. By doing such cure only, we can win the heart of the people. And atopic eczema, thuja vannam, tuberculum tenum, these potencies are very particular, and syphilinum tenum, which is close to the patient. If it is more, if there is more psychotic symptoms than thuja, then tuberculum, and more syphilitic syphilinum. So you have to take the family history. That is another story. When you are taking the case, the family history has to be drawn. Then only you can see the exact family tree. And drug allergies. So urticaria, natramur vannam, tuberculum vannam, and thyroidum 30. And drug allergy, sulfur tenum and tucre marmarum tenum. And insect venom, lysine 200. And for shellfish, bromium, lycopodium. So we are moving into more deep acting remedies, lycopodium. And wheat allergy, to prevent the recurrence after giving calcareous carb, you have to prescribe a dose of lycopodium. You know the cycle, sulfur, calcareous, lycopodium, like that. And egg allergy, lysine 200 and tuberculum vannam. And milk allergy, tuberculum vannam. So these are the end points. So I think the time is over. Otherwise,
we can go up to 5, doctor.
Okay, 5 minutes more.
Yeah, we can go up. No problem.
Okay. So regarding logical philosophical guideline. So see what are the miasm. Allergic rhinitis, upper respiratory tract infection is psoric, and allergic asthma, lower respiratory tract infection, psoric, psychotic, and tubercular is there. Atopic eczema, psychosoric. I am not going to explain in detail regarding the miasm. Why? Because it is time consuming. And drug allergies are psoric, and insect venom, sora, turned into syphilitic miasm later on. There may be chance of even death. And food allergies, tubercular, shellfish. Wheat allergy, psychotic. Egg is psychotic again, like that. So the logical philosophical guideline is like that. All allergies are due to psoric miasm. Okay. That is, allergies are due to sensitivity. That means it indicates psoric miasm. The theme of allergy is sensitivity. So that indicates the plant kingdom. If you are prescribing a remedy in the beginning or as a constitutional remedy without considering this protocol, it is better to select a remedy from the plant kingdom. This is almost all about allergy within half an hour. We can discuss cases later on. Preferably plant remedy when you are selecting the constitutional remedy, and for the establishment of permanent cure, it is better to select a anti-psoriatic plant remedies. So we are not going to discuss all the plant remedies, list everything. You might have heard it in your academic times. So we have to finish within the time. That is also important. Okay, what is the end point? So where there is no recurrence even after repeated exposure to the usage of allergens, then you can stop without medicine or placebo. You have to withdraw the placebo also. And after crossing all season of an year without medication, without any medicine, if you cross all the season of an year, then you can stop. This is the end point. You have to fix the end point when you are beginning. When you are treating the case, when you are taking the case, you have to tell the patient that I am going to treat you for up to this moment only. So you have to give it in writing. And if it is not relieved even after the stipulated time, just leave it. Just refer the case to your seniors, to a higher center like that. Nothing will happen, even though you are referring the case. But you are not supposed to treat until the death of the patient or until the death of the doctor. It's not like that. There should be an end point. It should not be like that. So this is the end point. So I think you enjoyed the session. Thank you very much for your patient watching. Though you are quarantined, like you are leading a quarantined like life in your home, stay home, keep the social distance. Let us fight against corona also. And I thank Dr. Karthik for giving such a splendid opportunity to interact with you through this medium. Thank you very much.
Thank you. Anybody wants to ask the doctor anything, they can ask online, or they can type into the message. The doctor can have a look, and any specific requests. Yes, Ajay. Your voice, we can't hear you, Ajay. I think your mic is. No, we can't hear you, Ajay. I think your mic is not activated.
You may test me. No problem. Send me a message.
Yeah, you can test, or you can send a message on the site, so everybody can.
Or you can send message to my phone number also, 944712879.
Oh, somebody's asked about egg and milk allergy remedies, doctor.
Okay, egg allergy remedy level or medicine level or drug level?
Oh, don't mention that.
Okay, so this is my way. In drug level, we are prescribing chininum ars and chininum sulf for egg allergy, especially for diarrhea and vomiting like that. And in medicine level, it is pulsatilla 1 and in remedy level, it is tuberculin.
Doctor, I didn't understand these levels. How do you go? Can you just repeat those levels again?
Okay, the level is drug level means there is an acute exacerbation of the disease. Patient is going to be admitted. Okay. So in such acute exacerbation, to relieve the symptoms only, if there is diarrhea, okay, the diarrhea has to come down. The temperature has to come down. So for diarrhea, vomiting, these are the complaints after taking egg. There may be severe diarrhea, there may be severe vomiting, temperature, like that. If it is with a foul smell, chininum sulf. If it is with the diarrhea, chininum sulf. For vomiting, chininum ars. And after relieving it, patient will take egg again. Am I right? Patient will go for egg again. So he can take a dose of pulsatilla and take the egg.
Okay.
So that is a medicine level. So it is a proven medicine for the egg allergy. And for number of times he is taking the pulsatilla and egg. No problem at all. So we have to stop medication. Then we are withdrawing the pulsatilla and allow the patient to take the egg. If there is no problem, then again there is chance of recurrence after 1 year or 2 years. So give a dose of tuberculin. That is a finishing dose. That's a finishing line.
Okay. Dr. Ajay has asked he was asking about Justitia adatoda and allergic disorders.
Gestational Adathora, it is good for cough. My experience, what I am sharing, good for cough, but it will act only in the beginning, 1 or 2 days. It won't act further. After 3 days, if cough started, after 3 days, it won't act.
What
It is
about
a
arsenic
traditional medicine.
iodide?
Arsenic iodide for allergic rhinitis to improve the general immunity. I am prescribing arsenic iodide along with tuberculum, 6x potency that we gave even for HIV patients to improve the. We have enough documents improve the CD4 and CD8 count. CD4 and CD8 count will definitely improve in immunocompromised patients only with this tuberculum and iodide 6. That we prescribe for 164 patients in our center. It's good, but there is one problem. This arsenic iodide will work only in hilly areas, not working in the coastal areas. This is my experience. In coastal area, natrum ars is working. Natrum preparations are natrum is working. Natrum ars is working in coastal areas, but in hilly areas, in our area is almost a hilly area. So arsenic iodide is working than anything. But in coastal area, take care. It won't work. I'm not telling it won't work. It's not that much working.
Okay. Anybody else have anything to ask? What about pollen?
Pollen allergy. Pollen allergy is not okay. Pollen allergy is not common in our area, but we are prescribing patients those who are abroad. Pollen allergy, bromium, pothos, and lysine. This is the bromium. Pothos is in the beginning, in the drug level, as I told, and in the medicine level, bromium, then lysine to finish the case.
Lysine is to finish it. Okay.
And one.
So,
okay, tell me.
Yes, no, please go ahead, doctor. Please go ahead.
Okay, some of my patients are telling that one patent product, polinoson, like that, it is working. I'm not prescribing polinoson like that. I think it is of Bioforce. They are taking and they are telling that whenever they are taking the medicine, there won't be any pollen allergy. They are purchasing from the medical store like that.
Medical. Okay. This is for everybody. This whole session has been recorded. We'll share the link. We'll share the recorded version so you can go through it and see it. You'll all get a link on your email or on the YouTube channel. You can see it. We'll also share it at the Sahia website. And I'd also like to thank Dr. Biju for doing this, and the wonderful work that he's doing at Sahia is extremely good. So I thank you, Dr. Biju, for this.
Thank you for giving this opportunity.
Yeah.
Thanks for still due to you, Dr. Karthik.
Not at all.
And so,
anything else?
Within half an hour. It is the first time I am doing such a work within half an hour without interacting with the participants like that.
Anyway, so we'll do more of these, doctor, and like I told you, we're open for this, and we'll do more of these seminars. I didn't know the time limit that you wanted, so the next time can be based on whatever time you want to allocate for each seminar.
According to I am coming with more protocols like diabetes protocol, dyslipidemia protocol. Why there should be a protocol? We have to repeat the disease results. There is protocol for everybody. If you are turning back your case record, certain diseases are coming in certain constitution only. 80% of such cases will be managed by such medicines. Our super seniors, they have also developed protocol. Some of them shared and most of them keep it as a secret. There is absolutely no secrecy. If you can produce more results, then more people will come to you. Then you will become more.
Definitely. All right. Thank you, everybody, and hope to see you again.